Once you have a diagnosis of hip arthritis, careful consideration of when a hip replacement is appropriate would need to be addressed by your care team. X-rays of your hip and your functional limitation will be reviewed to help us decide if a hip replacement will be clinically appropriate for your symptoms. Typically, it is only considered when all non-operative measures such as activity modifications, physiotherapy, and anti-inflammatories have been exhausted. When appropriate patients are selected, a hip replacement is a highly effective surgery in relieving pain, improving function, with a success rate exceeding 90%. When planning for hip surgery, there are two approaches you may wish to discuss with your surgeon. The first approach is called the direct anterior approach, where you will be positioned on your back on the operating table and the operation to your hip is done minimally invasively between muscles rather than splitting muscles. This typically enables for a faster recovery in the first 2 to 6 weeks. It also reduces limping due to muscle weakness post-operatively that is typically seen in other approaches where muscle is split. One of the drawbacks of the direct anterior approach is that in about 15% of the people undergoing this approach will complain of thigh numbness post-operatively. Although in majority of the patients this is a temporary finding, a small proportion may have it as a permanent issue. It is also a more technically challenging approach, especially in a larger patient with a higher infection risk in comparison to other approaches. The second approach is the lateral approach. In this approach, you will be lying on your side with the muscle split being performed on the side of your hip that will later be repaired at the end of the procedure. As a result, in the first 6 weeks, you will typically have a small limp that will improve as you recover from surgery near the 12-week mark. This is an approach that is often used in complex surgeries where a major reconstruction of your hip needs to be done, allowing for better access for both the pelvis and the femur. In most cases, either a direct anterior or lateral approach can be chosen by the patient. In some cases, your surgeon will help you make the decision based on your anatomy and other clinical factors that may make one approach more risky. Hip surgery is usually well tolerated by the patients and less painful than knee surgery. With the guidance of a physiotherapist, you will work on strengthening your muscle groups and getting used to your new hip over a period of 6 to 12 weeks.